Supreme Court upheld Tennessee's ban on gender-affirming care for minors in their ruling today. Good evening. I'm Kim Chattanooga with you.
And I'm Josh Rowe. Lawmakers who praise the ruling say transitioning is a big decision and should be done as an adult. One transgender student says the move impacts more people than just the LGBTQ community. Tennessee Senator Marsha Blackburn said in a social media post, quote, "This is fantastic news. Tennessee's law prevents kids from getting irreversible procedures that cause irreparable damage."
Fox Chattanooga's Ray Collado spoke with Tennessee Senator Bo Watson and a transgender advocate on what this decision means for our community.
It hinges on the idea that puberty blockers are irreversible and harmful to transgender youth. However, in almost all cases, that's just not true. Actually, at stake is that transgender children or minors, if they live in a state that chooses to ban gender-affirming care for minors, they will experience heightened rates of isolation from their peers.
The 6-3 vote by the Supreme Court justices roll back protections for the transgender people and prohibit minors from using hormone and puberty blockers to transition. James, a transgender student at UTC, says the court should focus on what he describes as more important issues.
The number one cause of death for minors in America right now, it's not drag queens, it's not gender-affirming care, it's firearms. Firearms kill thousands of children every year, and yet I'm not seeing the Supreme Court give any real consideration towards effective legislation to control the procurement and use of firearms.
Several lawmakers in our area, like Hickson Senator Bo Watson, call this ruling a victory for Tennessee. Senator Watson says lawmakers have a duty to protect children.
We feel a responsibility in the state legislature, as confirmed by the Supreme Court today, to protect children, not from bad decisions, but help children from life-altering decisions. And we would say that children need to make those decisions when they reach adulthood.
Following the ruling, the Supreme Court said the court's role is not to judge the wisdom, fairness, or logic, but only to ensure that the law does not violate equal protection guarantees. It does not. Senator Watson agrees.
They can't make decisions about voting. They can't make decisions about smoking cigarettes. They can't make decisions about drinking alcohol. Those decisions are left to adulthood.
But James argues this ruling will affect more than just gender-affirming care.
This also affects cisgender people because ultimately laws like this interfere with the ability of doctors and families to make medical decisions for themselves. And that's a problem that affects everyone.
In Chattanooga, Ray Collado, Fox Chattanooga.
2024 data from the Trevor Project shows 50% of youth identifying as transgender or non-binary in Tennessee seriously consider suicide the past year. 13% attempted suicide.